today with our presenters. So I'm Chris Esguerra. I'm the Chief Medical Officer here at Health Plan of San Mateo. Samarine Shami is our Program Manager, Population Health. She'll be speaking briefly. We have our co-presenters from the Chinese Health Initiative, so Connie Chen. Connie, hi. And Qfan Wang, also from BHRS. And our Filipino Health Initiative, Christy Morales, and then Pacific Islander Initiative, either Brittany Afu and Lucy Latu. Names I also recognize from way back when. All right, so in the chat, let us know your name, organization, what brought you here today. So in the chat to really help us just get to know you. And in the next slide, why are we doing this? Well, really, the whole point here is really affirming our allyship with the community and really celebrating and acknowledging the fact that we have a diverse community of members, providers, and staff, and really be thinking about and sharing the health disparities that we have identified, that we identify as a county, and therefore provide resources in supporting our membership, our citizens in the county, and really fostering that sense of cultural humility. And so the purpose overall, in the next slide, as we do make sure that we're clear on this, is that we understand why this is important to us as a health plan, and actually really learning about the richness of our community overall and how to better support our HPSM members who identify as Asian American Pacific Islander. One more slide really to be thinking about and just kind of using this to reflect a bit here. So I'm Filipino American, I'm an immigrant as well, and this is a shared sort of common story, and really thinking about why is it that, one, not only are we talking about this and really highlighting and elevating our voices, but also really to talk about this component here of just stopping the hate. So, we are committed to health equity and really thinking about equitable outcomes for our members overall. And yes, that talks about culturally responsive care and services, but also talks about thinking about a safe community for our members, because we need that kind of safety to be able to help our members achieve and maintain their health. In light of what has happened recently and what continues still to happen, this is why Stop AAPI Hate is part of our vision. Because really, when we're talking about healthy is for everyone, we're talking about health really needing to be able to thrive in safe communities. And that's part of our mission, and that's why this fits in very nicely. And so with that, I'm going to turn this over to Sam to talk about some of our work, but I think we'll start with the disclaimer and agreements first. Sam, you're on mute.
Hi, everyone, and thank you so much for being here. What we wanted to first set this meeting up with is just acknowledging that we are going to be talking about health outcomes and health issues and how they interact with race. And this isn't always an easy topic or an easy conversation, but we want you all and ourselves to view this as a safe space where participation is key and each and every one of your perspectives is important. So in order to maintain this together, we want to make sure we are following these 5 agreements that we can all hold together in this space. So first is to be present. And I know this is very difficult when you've got all these other things hitting you while you're on Teams, but please try to be present in this particular space. Please, we want to make sure that we honor silence and confidentiality here. And of course, you are all welcome, and we expect and presume that you are all welcome and that you expect this for yourselves and for others. Please speak your truth, but also let others speak theirs. And one thing that you will notice, especially about this community, is, this is a very large and diverse community, and no one knows everything, but together we know a lot. So we just wanted to set that up. And in keeping up with this concept of sort of this breadth of what this community covers, if we can go on to the next slide. This is just a geography that we thought was an interesting aspect of the illustrating the cultural heritage of many of our members who identify as Asian American and Pacific Islander. And as you can see, it covers a very broad geographic space. And so when we talk about the origins of cultural heritage of some of the people who identify as this as AAPI, we know that they share some cultural roots and values, but however, they are very diverse. So there is no one size that fits all within, especially when we're talking about this population. And so that includes both their cultural views and experience, but also in terms of their health needs, their health experience, and their health outcomes. And, we can talk about the next slide if we move on to the next one. And when we talk about diversity, what we wanted to discuss very briefly is if we just look at HPSM and their membership, and we just talk about just language, we can see here that over 30 languages are represented by our members at HPSM, and includes a broad range of what our Asian and American Asian Pacific Islander population comprises of, including Thai, Cantonese, Chinese, Urdu, and just to name a few. So we just wanted to highlight that. Next slide, please. And we're going to jump into some of the population characteristics of our AAPI members. And this information is from measurement year 2021. And so what we wanted to highlight here is you will see on one side of this slide, on the left-hand side, we're going to be talking about our members, but we also wanted to appreciate that many of our HPSM staff also have varied and diverse ethnic and cultural backgrounds. And if we first look at language preferences of our members, although many of them who identify as Asian American Pacific Islander do prefer English, we do see a large population that prefers Chinese and Tagalog, for example. And in terms of age, we also recognize that many of our members who identify as AAPI are older. 43% are over the age of 50. And the other thing that we really wanted to highlight is that 83% of our members who identify as AAPI fall within our Medi-Cal line of business. However, if we were to look at Care Advantage, actually the AAPI membership actually makes up a majority of the Care Advantage population. And then in terms of HPSM staff and our racial and ethnic identification, as you can see, 35% identify as Asian, and then we have about 2% identifying as Native Hawaiian or other Pacific Islander. So again, HPSM kind of reflects what exactly is also going on within our membership as well. In terms of geographical concentration, we just wanted to highlight where our members live who identify as AAPI, and actually they're pretty, much across the county. However, the ones that are highlighted in red are where many of our members live. So Daly City, San Mateo, South San Francisco, San Bruno, and Millbrae have some of the higher concentrations of our AAPI members. And just to highlight, the color does not indicate population size. We just wanted to show how each of our counties are set up. And we do have many of our AAPI members living across the county. I have presented some of our sort of stats around and quantitative data regarding our AAPI members, but we did want to highlight a little bit of the qualitative data that we do get from members and their overall experience, with attaining medical care. So overall, we do see that they have the lowest rating for overall healthcare experience that we've seen in the last 6 months. And some of the issues that they've highlighted is that some members have suggested that they are treated differently due to language. So this is a concern, and access to interpreters is definitely an area that we would like to pursue. And we continue to make that aspect of our work stronger. We do see higher rates of COVID vaccination among the AAPI membership. And we also found that 92% of this population felt that their doctor showed respect for what they had to say. So definitely some negatives, but also some positives in what we're hearing from members as well. In terms of health outcomes, we did want to highlight some of the areas, again, where we see health outcomes are pretty much going up or are positive. And some of these are higher rates of breast cancer screening for members who identify as AAPI. We also see a similar trend in cervical cancer screening, especially for members whose preferred languages are Chinese or Vietnamese. So these are very positive areas. We also see higher rates of adolescent immunizations for members whose preferred language is Chinese, as well as higher rates of diabetes care for members whose preferred languages are Chinese and Vietnamese. There are obviously always some areas in which we could see more improvement. We see a higher rate of gestational diabetes, for example, for some of our members, particularly those whose preferred languages are Tagalog and Mandarin. And our lower rates of adolescent immunizations are for our members who speak Tagalog. And we also see higher rates of low birth weight in members who identify as AAPI, although I will say that our data on higher rates of our data on lower birth rates is not perfect, but we have definitely seen that in this population, we see more of those lower birth rates. Next slide, please. And so, just to highlight, we do see those areas of opportunities, and we do have programs for some of these areas. For example, for gestational diabetes, we do have our Baby and Me program, which promotes maternal and child health, as well as comprehensive care for birthing parents. And we do have some resources available, especially for gestational diabetes, as well as updated information. For our diabetes prevention program, which is a health lifestyle change program to prevent the onset of type 2 diabetes, and that is also available for some of our members who've had gestational diabetes. And again, diabetes management, we do have websites and resources that are available on our website. Second slide, please, or last slide. And then finally, Okay, so there's some other resources that I encourage you to look at, and we will definitely forward these to you. But some of them include our asthma resources, our HPSM health tips page, as well as our language assistance services. And you can learn about any of these programs by calling the number below for our health ed line. And again, these will be available to you. We just wanted to highlight that we do have programs and resources specifically for some of the health outcomes that we see in that population. And now I will let our next speaker, Connie, I believe Connie is here. Yes, so from the Chinese Community Mental Health Services in San Mateo.
Hi, thank you, Sam. I'm going to request control. Is that okay of the slides? Okay, so hi, I'm Connie Chen. Thank you. Thanks. Yeah. Oh no, I just wanted to see if I could advance the slides, or should I just let you know when we go to the next slide? Maybe I'll just do that. Okay, thank you. Hi, I'm Connie Chen, and I'm one of the co-chairs of the Chinese Health Initiative. I'm also a psychiatry resident with San Mateo County, and my co-chair is also here, Qifen Temi Vong, who's a psychiatric social worker. And so we're both mental health clinicians, so we'll be focusing a bit more on the mental health aspect of Chinese community health in San Mateo County. But definitely this is a big topic. We'll talk for about 10 minutes, but definitely open to questions at the end. Next slide. Okay, just really quickly, we covered some of this, but AANHPI is Asian American, Native Hawaiian, Pacific Islander, or sometimes called AAPI for short. 7% of the US population, 60% of the world population, and in the US, we often lump all of these categories that you see on the right together, including Chinese, which is a large contingent of that AAPI population in the US, but interesting that there's so much diversity there. Next slide. In San Mateo County, AAPI comprises over 30% of the population. Interestingly, for San Mateo County, Medi-Cal eligible patients, we have some of the lowest penetration rates for specialty mental health services among ethnic groups, so lower than white, Black, Hispanic, or Latino. It's not out of a lack of need, as I'll be talking about. But it's certainly an area where we're trying to reduce stigma and encourage access to mental health services in our communities. Next slide. So a little bit of basic information about Chinese communities and the Chinese diaspora. Just as within AAPI, there's also a lot of diversity within what we might term Chinese. National identities, people who immigrated from mainland China or from Taiwan who might identify more as Taiwanese national identity or cultural identity, but there might be overlap with people who immigrated from mainland China or Hong Kong, and then differences as well in terms of language. And then you see also the different generations of folks who have a background of immigration from other countries. First generation who might be more monolingual, Chinese speaking, second or third generation who might be more acculturated, might be English speaking only and not need a translator for services. Essentially, it's not one size fits all, which I'm sure many of you know as clinicians and providers. And we can do our research and learn information about different communities, but be ready to adjust on a case-by-case basis. Next slide. So some statistics on mental health in AAPI and Chinese communities. So according to 2021 CDC data that came out, suicide is the leading cause of death among young Asian Americans aged 15 to 24, which isn't the case among any other ethnic groups in that young age group. Also some data from San Mateo County 2019 to 2020, we saw an increase in suicide deaths among Asian males born outside the US, including countries of origin of China, Hong Kong, and the Philippines. And we'll talk a little bit more about programs that we have in response to that later. This is kind of interesting population level data, kind of an older study from 2013, but relevant to the AAPI population overall. So the study looked at all the psychiatric hospitalizations in Hawaii, which has a huge AAPI population over about 10 years, looking at about over 300,000 hospitalizations, and the AAPI population tended to have greater severity of illness and longer psychiatric hospital admissions than other groups. There's a need for more research on why these trends exist, but a lot of different theories for why we see that greater severity of illness and maybe waiting longer to get professional help. There might be more help seeking through other means, like within family or friends or community figures, religious communities. We know based on, I guess, like our own lived experience in the culture, that there's stigma. There can be stigma towards mental illness and mental health help seeking. In our communities, there might be underdiagnosis of mental health conditions from the systemic perspective, and from the clinical perspective, maybe not enough culturally sensitive or language competent, Chinese, Mandarin, Cantonese speaking clinicians. So a lot of different theories as for why we see those disparities. And, just speaking overall on mental health in AAPI communities, there's of course, the effect of anti-Asian hate incidents, which have been receiving increased attention since 2020, and certainly affected the mood and mental health. Next slide. So this is kind of a slide about essentially that ways of expressing emotional distress might vary, based on a lot of different things, based on not even bringing in race and ethnicity, based on our personalities, our upbringing, gender roles, but culture plays a role as well. And for all the providers and clinicians out there, this is something to keep in mind. In the Chinese community, there has been kind of cultural psychiatry research done on the ways that emotional distress, especially like depression, might be expressed. Oops, can you hear me? Yeah. And these studies were kind of done in a monolingual Mandarin-speaking population in China a few decades ago, but it's just an example of how to be attuned to the different ways that people express emotional distress. And there's this concept called neurasthenia, or in Chinese, it's called 神经衰弱. And it's kind of the idea that depression can be expressed in terms of physical ailment or bodily symptoms. And so, for example, like these criteria are used in the Chinese version of the diagnostic manual. Persistent or distressing exhaustion after minor mental effort, kind of these bodily symptoms of muscle aches and pains, dizziness, headaches, sleep disturbance. And in studies, these map very well onto like the criteria for major depressive disorder. So this is not to say that we should go out there and assume that everyone who says that they're tired or dizzy is depressed, but I just wanted to plant a seed about the different ways that emotional distress might be expressed, and that our systems and standardized ways of eliciting that might need to be flexible. Next slide. So talking a little bit about the Chinese Health Initiative specifically, so we were created in 2007 out of the San Mateo County Office of Diversity and Equity, along with other health equity initiatives focused on promoting cultural competence and addressing health inequities in minoritized communities in San Mateo County, including the Chinese community. Our membership includes community partners, consumers and clients, family members, clinicians like ourselves. Our goals are to raise awareness of health issues and availability of services through outreach and education, educate the health system and partners around cultural issues and barriers, and advocate for services that are culturally and linguistically accessible, and work collaboratively with partners to facilitate access to services for the Chinese community. Next slide. So a little bit about some specific programs that are active now. The first is a program that we called Asians Be Well, and started in 2021, I think, in response to what we were hearing about increased anti-AAPI hate incidents and fears expressed by Chinese community members about their elderly parents, or about elderly folks being concerned about being out in the community. And so we partnered with Self-Help for the Elderly, which is an organization in the Bay Area that provides a lot of Mandarin and Cantonese language capable home care services for elderly and community activities, as well as with this group called Travando, which is also focused on community engagement with the elderly, to provide seminars, community groups on wellness topics. And so my co-chair, Tammy, facilitated a wonderful listening and healing circle in Cantonese that was open to elderly adults in the community. And we've also had sessions on cancer screening, as well as nutrition. And the sessions are all in Cantonese and focus on these mental health and wellness topics. Next slide. Another initiative that we have is a partnership with Mills High School, which is has a significant Asian student population. And this is a youth leadership program, a club that's open to all the Mills students. And it's facilitated by a psychologist that we're working with from the Wright Institute. And they set up seminars for the high school students at Mills, as well as mental health awareness fairs. They had one last week, actually, to provide resources on local mental health services, and basically to have a discussion amongst the students about these topics. Next slide. And lastly, a program that we've been working on with Sylvia, one of our community health planners from the Office of Diversity and Equity, and Dr. Joyce Chu, who's a professor at Palo Alto University, is called the Be Sensitive, Be Brave program. And so this is a culturally adapted mental health and suicide prevention workshop series in Mandarin for the Chinese community. And this is in response to that data that I mentioned earlier about increased suicide rates amongst amongst Asian men born in Hong Kong, the Philippines, and China. And it's open to the public, actually. So if you know anyone, a community member or a clinician who works with Mandarin speaking clients who would be interested in building up skills to use as far as mental health and suicide prevention, please feel free to reach out. This is another program that we're working on. Okay, next slide. And last slide, just a few resources to share out. So our Chinese Health Initiative monthly meeting is the first Fridays, 1:30 to 3 p.m. in the afternoon on Zoom, and anyone's welcome. Clients, clinicians, community members, you don't have to be Chinese either. We welcome everybody. We also have a Chinese family support group that Tammy facilitates on a monthly basis, a Chinese community referral line. We have an outreach worker who can assist in Mandarin or Cantonese with linking community members with mental health resources through this phone line. And then Mental Health Association for Chinese Communities and Self-Help for the Elderly are some great local organizations that have activities and groups. And please feel free to email us for any more info.
All right, thank you so much, Connie. Christy, do you want to take over?
Sure. Good afternoon, everybody. My name is Christy Morales Kumasawa. My pronouns are she, her, hers. I am an associate marriage and family therapist, finishing up my clinical hours at the Daly City Youth Health Center. I'm also co-founder and associate director of Kapwa Cultural Center and Cafe, which is a new social enterprise. We haven't opened our doors yet, but we are currently piloting programming. I'm also one of the co-chairs of the Filipino Mental Health Initiative. My colleague Stephanie would have liked to be here, but she had a family emergency that she had to attend to, but she wishes she could be here. So in terms of the Mental Health Initiative, could you go to the next slide, please? So these are the frameworks, and before I talk about our value system and our frameworks and the way that FMHI approaches our work and how we approach the community. So similar to the Chinese Health Initiative, the Filipino Mental Health Initiative's three main goals are to create access to culturally responsive services and resources, to reduce mental health stigma, and to increase outreach around mental health awareness and education within the Filipina EXO community, and also just engaging the community to be part of our mission and empowering them. So when we talk about foundational frameworks, we talk about two sort of indigenous concepts or values, which Kapwa means shared identity, seeing oneself in the other, and Ginhawa is roughly translated as total wellness. And so these two things are important because Kapwa sort of speaks to the collective. We are a collectivist community. And in that value, it's important for us to recognize the importance of really bringing community together in culturally responsive ways. Next slide, please. So there are about 4.2 million or 18% of Filipina EXOs in the United States, in San Mateo County alone. That makes up about 70,000. And this slide references how obviously we're sort of spread out throughout northern San Mateo County, but in terms of concentration, Daly City by far has the largest concentration of Filipina EXOSs. And well, that sort of plays an important role in like the work, sort of the work that we're doing and some of the new projects that we have recently launched. And I'll talk a little bit about the cafe and how that is sort of unfolding. Next slide, please. So we see the slide beforehand kind of showed the breakdown of Filipina EXO folks in northern San Mateo County. This slide we included because it talks about language in terms of like the primary languages spoken among Filipina EXOs in this region. Obviously, the top three are Tagalog, Visayan, and Ilocano. But it is important to note that among folks who speak Tagalog, you're not going to have every Filipino immigrant or person who actually knows how to speak or write in Tagalog or understand actually. In fact, in my experience, my grandparents, they actually didn't speak a word of Tagalog because they spoke Ilocano. And so that's just something important to keep in mind. In San Mateo County, Tagalog is a threshold language. But obviously, there are still some challenges around outreaching to some folks who may be more comfortable speaking some of the other languages. While these are the top three languages, in the Philippines, there are actually 13 major identified languages. And depending on how you classify languages in terms of different regions, there's actually more than 120. The Philippines, when you're talking about folks who immigrate from the Philippines, it's an archipelago of more than 7,000 islands with 2,000 of those islands inhabited. So if you think about how folks are widespread and just that amount of diversity within our population, then that sort of shows you, why there are so many like different languages. Next slide, please. So sort of like in a similar vein with Chi's work, we focus on mental health. And a lot of the slides that we're presenting focuses on youth because that's sort of one of our major projects right now. But in terms of looking at this slide and why it is important, I think Connie talked about, the disparities in terms of, suicide, depression, anxiety, and suicidal ideation. And so we see here, and these are statistics from 2010 in terms of Filipina exos among teens. You could see here like the big disparity in terms of who is at risk for depression and suicidal ideation. Almost half of Filipina exo youth are at risk for this. And I could talk a little bit about why, and that's sort of going to dovetail with like why we're doing what we're doing in terms of our approach. So there's clearly a disparity, and this is what this slide is here to illustrate. Next slide, please. So when we talk about our approach and wanting to create space and create approaches that are culturally responsive, we recently, FMHI, we went for a mental health services innovation grant to create a social enterprise that mainly focuses on youth. And so we saw that slide about the number of teens who are at risk for depression and suicidal ideation. Well, with Filipinos being one of the fastest, growing ethnic groups, out of that, AAPI umbrella, we are one of the lowest in terms of like utilization rates for mental health services, as that's probably something also mirrored among other groups. But of course, I'm speaking to our specific group that we work with. And so the issue with that, as we see with other groups, is that a lot of the issues or some of the things that can be pointed to in terms of nuances in needs and challenges were often aggregated under that, the common umbrella term, right, the AAPI term. And so we're not necessarily getting a full grasp, right, of the disaggregated data that could be helpful in terms of really looking at what services and resources are going to be most helpful. And so when we talk about some of the barriers to treatment, obviously this is only one. In terms of like mistrust, of like some, I wouldn't say like all providers, obviously, right? But there has been historically this mistrust with the way sort of the Western medical model may approach some of the challenges that some of the folks in my community experience. And so there's also the challenge of things that, of having services that are not necessarily linguistically or culturally responsive or appropriate. And that also factors in terms of a barrier in terms of people seeking services, especially when it comes to mental health. Next slide, please. So we include this in here because in our focus groups and surveys, as we were trying to figure out what folks, wanted and needed in this, when we were applying for the grant, the Mental Health Services Innovation Grant to create this social enterprise center in Daly City, people told us that it really is important for them to have someone who can really relate, if not necessarily be a part of, being Filipino or part of that, that cultural group. But it is important to them. Folks did say in the survey that they might feel more comfortable in terms of approaching help or approaching, let's say a mental health provider, if they did come from, their cultural background and had a grasp and understanding of like some of the challenges that are culturally specific to the Filipina exo population. And so, as you can see, there still is a disparity in terms of the number of like BIPOC providers that exist. And this is also obviously a 2016, these statistics. So these numbers might have shifted a little bit, but I think overall we still have more white providers than we do BIPOC folks And that's changing, and that's one of the reasons why myself and my colleague Stephanie have entered the field in order to fill that gap. Next slide, please. So I made references to how we came up with the proposal that we did and why we have sort of this approach in place for how to engage our youth and community around this social enterprise that we're creating. We did a community needs assessment and a survey and some focus groups where we had a focus group of like, I believe it was 5 focus groups, 2 youth groups, a group of elders, and then 2 adult groups. And we continue to plan on doing more. But in terms of what we found in sort of this like needs assessment approach, we found that folks do want to be able to improve their mental health, and that culturally responsive services are important to people. And so with that being an important consideration, there were about 281 respondents that we had in the survey. And then out of the focus groups, we had about 40 people. And other things that were sort of mentioned in that needs assessment were, easy access to services, obviously, being in a place where it would be easy to get to in terms of transportation, and also it being intergenerational in nature. So while I'll talk a little bit later about the social enterprise, while this particular core program is for the youth, this space is meant to be intergenerational for our older adults, for families. But as I mentioned, when we launch our programming, it's mostly going to be youth-centered, and then we'll sort of build upon that. Next slide, please. This sort of just goes into some other things that our focus group found to be important, is that I mentioned intergenerational connection, mental health education, and a safe space to talk about these things. Not necessarily, direct service therapy, but just having a safe, supportive space, sort of like a support group for folks to be able to come together and have shared experiences and engage in storytelling, which is something that we found to be very effective in terms of getting people to open up and to just talk about their challenges, which does, provide a certain level of not just support, but we also see that as folks open up more, people become more open to considering like what are some of the resources and services that might be helpful for them and their families. And I think one of the things that we really want to stress is the importance of preserving Filipinx culture and prioritizing Filipinx values, because as we know from our research, not our research in particular, but from like some Filipino psychologists have found that cultural identity formation or positive cultural identity formation is something that is correlated with wellness. And so we want to be able to help, especially our youth, be able to connect with their cultural heritage, their background, because what we're noticing is that there's definitely this bicultural clash of values that often contributes as a stressor. And so these are some things that we're cognizant of. We also want to be able to recognize the importance of just, the whole person, not just mental health, but also talking about physical health and linking folks to resources and other supports that will support the whole person. So this is what I was talking about in terms of Kapwa Cultural Center. And the reason we mentioned this in this presentation is because it's going to be a very unique center in that it will be sort of like a hub of different things, whether it's linking folks to mental health, other health resources, other social services, because I don't think I mentioned earlier that Kapwa Cultural Center and Cafe is actually a program of Daly City Partnership, which is an existing nonprofit in Daly City. They've been around since 1995. And so we'll be able to provide a wider array of services because of our the fact that we're linked to the Daly City Partnership. Next slide, please. So I already mentioned how we got the funding for this project, and that it's a social enterprise model, which is basically pointing to holistic and culturally responsive approaches to helping folks with their needs. It's intergenerational, and it's sort of the first social enterprise that incorporates not only mental health, but leadership skills and workforce preparedness skills. Specifically with our youth program, which will be a cohort model. Next slide, please. And what this will do under one roof would be to address cultural stigma and address also the fact that people don't utilize mental health services, even though there is a need. So we'll be able to link folks to that, as well as being able to really promote a sense of cultural pride and being able to honor cultural practices and even cultural wellness practices that maybe don't necessarily fall under the Western medical model. And so with these services, we're hoping to help reduce rates of depression, anxiety, and suicidality rates, as well as address the issue of dropout rates, which we see among in our youth. There will be roles in leadership, mentorship, as well as entrepreneurial and career development. Next slide. So if you could just toggle through, I'll just go through this quickly. This is sort of our visioning of what we want our cafe to look like. Sort of in progress, but we're working with folks to really build out this space. This is an example of some of the things that, if you could stop right there, an example of some of the programs and offerings through FMHI, which we hope to also extend to Kapwa Cultural Center. So this was to address what was happening with the rise in anti-Asian hate and violence. We partnered with Escabo Daan to create or to offer to families, elders, and youth self-defense classes. And so this is just an example of a culturally responsive offering that not only addresses physical safety, but as we know, if someone is having anxiety and is worried about their own safety, those two things, can be impacted in terms of emotional, not just physical safety, but our emotional safety, right? Which in turn impacts mental health. Next slide. We have a support group that we do. We used to do it twice a month, but now we do it once a month. And so just another example of a space where folks can just come, like anyone in the community. You don't have to be from the Filipina. Other folks come and join us. It's just a brave space for folks to share what's coming up for them.
And thank you so much for this. And we'll be sure to send out any slides and have additional information.
Sure. Yeah, so I apologize because I didn't prepare this, because I stepped in last minute. So I apologize about the timing. So hopefully folks can read through the slides and be able to get the information I didn't share.
No worries at all. I'm so sorry to interrupt you. I wanted to keep
No
listening.
worries at all.
Thank you, Christy. Brittany, do you want to take over?
Yeah, sure. I just want to check how many minutes do I have before we have Q&A so I can be mindful of how fast I need to move through.
Take the rest of the time on the 10
Okay.
minutes, and then we can address questions later by email.
Okay, cool.
Thank you.
Thank you guys for the opportunity I have to share information about the Pacific Islander Initiative. My name is Brittany. I'm one of the co-chairs. Lucy Latu, I believe she might be still on the call, but I'll be the one going through the presentation today. I'm an initiative associate through the Peninsula Conflict Resolution Center. We're a subcontractor from the county in housing, PII, and also doing some of the community grassroots work through our organization. Next slide, please. When we are talking about Pacific Islander, specific to our initiative and even to our work, we're specifically focusing on the South Pacific region. So that includes Polynesia, Micronesia, and Melanesia. And within each of these different island groups, each island nation has their own language. So within our islands, there's, some, I heard Christina was sharing that her family speaks Ilocano, whereas like in the Philippine country, there's different dialects in the same country. But in the South Pacific, each island has its own language and there's not really different dialects. So that's one thing to understand. Some do share common words, and some languages sound similar, but they're all very much different and diverse, not only in language, but also in indigenous and cultural practices. Next slide, please. So who is the Pacific Islander Initiative? We're a collective of community members, community-based organizations, and allies who advocate for the well-being of Pacific Islander families. The PI initiative was created to address health disparities within the community and to connect families to San Mateo County resources and services that they might not know about but are eligible for. And so we touch on that mostly because a lot of our elders are immigrants, or like my mom, she's an immigrant but was US raised, and didn't know what resources and services she would qualify, not only as undocumented, but also as an immigrant. So our organization or our group goes about the community educating and linking some of these families to those resources and services. We also act as a linguistic and cultural broker between the PI community and resources and service providers. Next slide, please. Our mission is to raise awareness on the Pacific Islander community in order to dispel stigma associated with mental illness and substance use disorders. We found, if you guys remember some of the data that was shared by our cousins in the CHI initiative as well as the FMHI, that within the AA NHPI data, NHPI makes up a very small, of the already small data, right? And so we've seen that although we make up a small percentage of the population, a lot of our families, not even a lot of our families, but of like people who are incarcerated or parents who are going through CPS issues or high school graduation rates, we were making up a lot of those numbers. And so we learned that through immigrating to the country and acclimating to the United States, that a lot of our normal ways, like family and community nuances, carried on to the States, but are kind of illegal here. For example, like hitting your kids. So that induces trauma. And so we created spaces where families can come and talk about some of those experiences and learn about how to better discipline your kids or how to better communicate with schools when your kid is not doing well and how to advocate in an effective and efficient way. And so we conduct mental health first aid classes. We also have free Pacific Islander focused parent project classes. We also host digital storytelling, photo voice, and other avenues where we collect stories from our community, but also use those as conversation starters so that we can push through the experience, learn from the experience, and also break those chains of trauma and things like that. Together with service providers throughout the San Mateo County, we also strive to address all barriers experienced by the community when seeking and accessing services. So the other thing we saw was we're educating our community on how to access services. When they would walk through the doctor's office, the doctors didn't know what to do with our families. And so we created this How to Serve the Pacific Islander training. And so we give tips and tools on how to serve elders and young people, understanding that sometimes if a young person is being served, the adult that's with them might not be their parent, it might be their grandparent, their aunt, uncle, cousin. And so we hope by having that community approach, working with families and also with the service provider, we can create more well communities. Next slide, please. When we talk about PI community health disparities, we also are keeping in mind the social determinants of health and how that affects our families and community as a whole. Like I shared, many families are migrants to or immigrants to the US. And a lot of our elders don't have a great education background, and so they settle for low-paying jobs or working under the table. These same families also do not take the cost of living into account when they move to the States. Where we once ate and lived off of the land, they they are now finding themselves in a situation where they have to earn income and also pay for food. And so that also impacts economic stability in the home. In 2013, the PI initiative completed a community needs assessment and found that many families did not have health insurance because they did not know where or how to gain access. We later partnered with the San Mateo County offices to focus on enrolling families into health plans through Covered California. So that included documented and undocumented individuals. Many PI families migrated to the Bay Area specifically, well, they migrated to the Bay Area, sorry, two different stories. Tongans came to the Bay Area through the LDS Church and going to school at BYU Hawaii. And so they would enroll BYU Hawaii, found their way to San Francisco. Many of the Samoan families that we've worked with found their way to the Bay Area through military. So American Samoa is a U.S. territory. So individuals would enroll into the Army there, then find their way to the States here. Most of those families are like Bayview, Hunters Point area, some in Sunnydale. And then from there, you'll see that a lot of families kind of spread out throughout the rest of the U.S. So right now, what used to be San Francisco, Salt Lake County is now the highest population of PIs outside of the South Pacific. And a lot of that has to do with Delta Airlines being a hub in Salt Lake, and Salt Lake Delta flies directly to a lot of the Pacific Islands and then also to a lot of other places where family lives. So Las Vegas, San Francisco, Florida, Texas, that kind of thing. I actually live in Utah. And that's why I moved to Utah, because Salt Lake is a hub for Delta Airlines. And then lastly, education access and quality. So many families migrated to the country for better education opportunities for their children and grandchildren, which is the American dream. And so it's a pretty big deal when we have kids who are, or young people, even older people who are going to college and graduating from college, because they're really carrying the dream that their parents and grandparents came to the States for. Next slide, please. So some key health concerns that our community experiences are diabetes, high cholesterol, high blood pressure, infertility due to Agent Orange, hepatitis B or liver cancer, obesity, breast cancer, mental health and behavioral health, and COVID. The Pacific Islanders from the South Pacific are very new to the US. And so a lot of the times they're not well versed in preventative healthcare. And so a lot of them don't get their annual physical. A lot of them don't see doctors until it's too late. And so a lot of our focus is focused on preventative healthcare, preventative health on both the physical health side as well as the behavioral or mental health and behavioral side. I didn't include a lot of data here, mostly because as I was going, oh, sorry, you can go to the next slide. As I was looking for data, I was having a hard time finding disaggregated data. So we are very much like shared by our other cousin initiatives. We're very much lumped together. And so there is a regional Pacific Islander task force in the Bay Area, and they've been working really hard on collecting disaggregated data, just so that we can also show that we have very unique needs that are different from our Chinese, Indian, Filipino counterparts. Although there is a ton of need for all of us, everyone's needs are diverse and unique as well. And so, for example, when we get kind of lost with our Asian cousins, we lose out on programming, we lose out on funding. And like a couple of months ago, I had an agency reach out to me and I was like, hey, we want to partner with you in doing some work for PIs in hepatitis work. And I was like, oh, okay, that's cool. And then we met with them more and I was like, we could have just got the funding and did the work ourselves instead of you guys getting it, asking us for help, and then, you know, all of that back and forth, which at the end of the day, we're also advocates for disaggregated data for each and every one of our ethnic groups. The next slide, you can kind of just skip through. I know everyone will get the slides eventually.
Brittany, I just want to pause. It is actually 1 o'clock, and I know there are some folks who've had to hop off. But I don't know if you have to. I'm sure some folks can stay on, and I see folks who are staying on. So I guess I want to pause and invite anyone who can stay to stay. And if you can, Brittany, and finish the presentation, I would be very appreciative, and we'll send out the recording for folks who miss it. But just a request to our guest speakers to maybe just put in the chat an email address where folks can follow up if they have any questions. That would be really helpful as well. And like I said, anyone who can stay is invited to stay, and I would very much appreciate it if you could complete it.
Oh yeah,
But
sure.
also understand if you can't.
I think I only have 2 more slides and then I'm done.
Thank you.
That'd be perfect. I would be very grateful. Thank you.
Okay. The slide that we're on right now is tips and tools in working with the Pacific Islander population. The humble approach is just understanding that we're very intuitive people. So if you are approaching an elder or a young person from a know-it-all kind of standpoint, that's already a wall that's put up into making connection with the individual or the patient. So just being humble is very helpful, and it also makes us feel more open, which also leads to building a relationship of trust. More often than not, Pacific Islander individuals and families don't trust healthcare. We have our own indigenous practices in healing, and so westernized medicine is not really appealing. And so just understand that that's sometimes where our families are coming from. Ensure confidentiality is really important because the coconut line is super fast. So if one person is walking out of the clinic and another person is walking in the clinic, that person walking out is gonna, could be on the phone like, oh, guess who I saw at the doctor's office? I wonder what they're here for. So as a practitioner or as a service provider, as long as you're ensuring confidentiality, that the information from the patient is not going to be shared with anyone, is extremely helpful. Work with and utilize local Pacific Islander organizations, groups, faith leaders, and community leaders. The next slide will have a list of different organizations that we work closely with, and that's not all of them. There are a ton out there that are not listed. Yeah, so here are some of the folks. I'm not going to go through all of them just because it's already there, but resources or just our initiative website is there. PCRC, that's my organization, and then depending on what kind of work you're looking for, kind of support you're looking for, you can just reach out directly to me and Lucy, and we'll help make that connection. And that's pretty much it.